Hello everyone. Today, just now, it has been announced that Covaxin can be used for children aged between 2 to 18 years. Right? DCGI has given approval for the use of Covaxin in children's between 2 to 18 years of age, and it's a big breaking news, I will say. Means in adult we have already taken the two doses of Covaxin. Most of the people in India have been taken these doses, but now it is available for children's, right? DCGI notes for the trail on children's. So Covaxin in children's, it gets an emergency approval. It gets an emergency approval, emergency use of approval for kids aged between 2 to 18 years of age. The subcommittee on COVID 19, the subject expert committee on COVID 19 has granted emergency use approval, right, to the Bharat Biotech's Covaxin. We all know that Covaxin is a Bharat Biotech vaccine. It's made in India, and you can give now in the age group of 2 to 18 years for the children's. So it's a big breaking news, I will say, right now. And Hyderabad's based Bharat Biotech had completed the phase 2 and phase 3 trials of Covaxin on children below 18 years of age, right? They have completed the phase 2 and phase 3 trials already on children's below 18 years of age, and they have submitted the whole trial data to the DCGI. DCGI, Director Controller General of India, at the start of this month, means in October only, right? After detailed deliberation, the committee recommended for grant of market authorization of the vaccine for the age group of 2 the restricted for the restricted use in emergency situation. Okay, that is the very good news. Now here, this is the important thing for us. Now what is that? Bharat Biotech's Covaxin that we all know. The Made in India vaccine will administered in two doses. The first dose with a gap of first and second dose. There should be gap of 20 days between first and second dose. Right? The emergency use authorization is however subject to certain conditions. The important thing, there is a gap of 20 days between first and second dose. After that, they have to submit whole data about the post marketing surveillance of the Covaxin. Means the emergency use authorization, it is subjected to certain conditions. Now what is that condition they are saying? The developer of Covaxin will continue the study as per the whole virion, right? Means they have to conduct the study as per the whole virion inactivated coronavirus vaccine, the approval clinical trial protocol. Means they have to continue their research regarding the same. It will have to provide, they will have to provide what they have to provide: updated prescribing information. They have to provide updated prescribing information, package insert, summary of the product characteristics, and fact sheet. When it is given approval on certain conditions, means they have to provide updated prescribing information, means to whom they have given. You have to maintain the data, you have to maintain the records, you have to maintain the package insert record, summary of the product characteristics, and fact sheets. Means everything you have to maintain the record. Same they are keeping for the adults. Then moreover, the firm should submit the safety data. Everyone is concerned about the safety, right? In children's or in adults, everyone is concerned about the safety. The firm should submit safety data, including the data on the AEFI. AEFI means adverse event following immunization, and AESI, that is adverse event of special interest. AEFI means adverse event on following immunization and adverse event on special interest with due analysis every 15 days for the first 2 months and after monthly, and also as per requirement of clinical trials rule 2019. Means they have to submit the safety data. Means after this also, means after the approval from the DCGI, they have to submit the safety data through the AEFI and AESI with due analysis every 15 days for the first 2 months and thereafter monthly as per the requirement of the new drugs and clinical trial rules. Means don't worry about the safety, not yet by the WHO. Means the WHO is yet to grant emergency use of authorization to Covaxin. DCGI has been given approval, not yet by WHO. This is the important thing that you have to take care. WHO is not yet given approval, but DCGI, which is the highest authority in India for the approval of the drugs and vaccine, DCGI has given the approval, but the WHO is yet to grant emergency use. Bharat Biotech had reportedly submitted all documents required for the listing to the WHO by July 9, and the WHO reviewed the process, which takes close to 6 weeks and had commenced by the July end. Right? Now back in August, India has also granted emergency use approval of Zydus Cadila, Covaxin D, Zydus CoV-D, not Covaxin, it's a Zydus CoV-D COVID-19 vaccine for children between the age group of 12 to 18 years. The vaccine is developed by the pharmaceutical company Zydus Cadila and it was the first DNA vaccine to be approved in the world. First DNA vaccine which is approved in the world, which is developed by the Zydus Cadila. The name of the vaccine is the Zycov-D, not Covaxin. It's a Zycov-D which is developed by the Zydus Cadila and it's the first DNA vaccine. The safety and immunogenicity of COVID-19 vaccine, that is the Covaxin, is almost same in the children as in adult above 18 years of age. And it is reported news as per the news agency ANI quoting an AIMS professor. As per the ANI news, which is quoted by the AIMS professor, now what he was saying, he is saying that the safety and immunogenicity of India's Covaxin are almost same in children as well as in adults above 18 years of age. So don't worry about the safety and immunogenicity. It is reported by the news agency ANI, which quoting an AIMS professor. Right? Now Covaxin trial was done in 3 groups. The first group examined is 12 to 18 years. Right? The second group years of age and the third group is 2 to 6 years of age. The Sanjay K. Rai, a professor at the Center of Community Medicine, All India Medical Science, he was the principal investigator. Right? Globally, it is observed that SARS-CoV-2 isn't fatal for children. Means we have seen that many of the neonates, infants, they have been infected with coronavirus, but this SARS-CoV-19 wasn't fatal in children or isn't fatal in children. It will create only mild infection at present. In a few children it is milder than the common cold. It is very milder than the common cold. Currently we don't have any justification on whether Zydus Cadila, Bharat Biotech, Pfizer or Moderna, which is the mildest. We don't have any justification. These vaccines, lastly, I would like to stress These vaccines are reducing the severity of infection, not the infection. Please take care of that. And it is quoted by the AIMS professor. These vaccines, they will reduce the severity of infection, not the infection, only reduce the severity. It is not a guarantee that if you have taken the vaccine, the corona will not going to infect you. It is not possible. It will reduce the severity of infection. It will create only mild infection. So please take care of that. But according to the DCGI, safety and immunogenicity data will be same as per the adults only. So don't worry about this. Please go ahead and you can take the vaccine as per the data. But before taking any risk, please go through the detailed knowledge regarding vaccine. What is the dose, to whom it should be given, what are the contraindications, and all the things before going for the vaccination. Thank you.